Welcome students to our new YouTube channel Pharmax Tech, the division of excellence. Let's start to the new chapter of pharmacology, which is non-bacterial infections, including antiviral, antifungal, and antiparasitic drugs. Let's start. In this, we first see the antiviral drugs. In the drug therapy of viral infections, it has proven that these antiviral drugs, they are difficult to exploit the differences between the viral processes and the host cells. And these antiviral drugs, they are used to tend to suppress the viral activity, but they do not eradicate the infections. For example, in herpes infections, the antivirals have to be given at the start of an attack in herpes disease to limit the infections. Next we see the first antiviral drug. The first antiviral drug we see, which is acyclovir. This acyclovir is a nucleoside analog which undergoes the phosphorylation to its monophosphate in a virus infected cell via the viral thymidine kinase, and the monophosphate is then converted to the triphosphate, which inhibits the viral DNA polymerase, and so they prevents the viral DNA synthesis and the replication. The acyclovir triphosphate, these may also be incorporated in a viral DNA and it causes the chain termination. And this acyclovir, it is also used in herpes infections and some cases of chickenpox, that means varicella, for example in severely affected adults. The next antiviral drug is ganciclovir. The ganciclovir is a guanine analog which is phosphorylated in herpes infected cell to the monophosphate, and the triphosphate inhibits the herpes and cytomegalovirus DNA polymerase to inhibit the DNA synthesis. Next we see the viral neuraminidase inhibitor. The example of viral neuraminidase inhibitors are zanamivir and oseltamivir. These zanamivir and oseltamivir are the examples of viral neuraminidase inhibitors, and these inhibit the viral neuraminidase and they prevent the entry of release of the viral particles from the host cells. And these drugs, they are effective against the influenza A and influenza type B. Next we see the anti-HIV drugs. These anti-HIV drugs, these have substantially improved the outlook for the patients which are infected with the human immunodeficiency virus, that means HIV, and they may keep the infection in a check for a substantial time. And there are four main classes of antiretroviral drugs, and they are used in a combination, usually three, to attack different stages of the viral cycle. The first one is nucleoside reverse transcriptase inhibitors, and examples of these nucleoside reverse transcriptase inhibitors are didenosine and judoudine, that means AZT. And these didenosine and judoudine, they are phosphorylated by host cells to 5-triphosphate, which are incorporated into viral DNA by viral reverse transcriptase. And these nucleoside reverse transcriptase inhibitors, it leads to the chain termination. The next one is non-nucleoside reverse transcriptase inhibitors. Examples is epavirins. And these non-nucleoside reverse transcriptase inhibitors, they are bind to and they inactivate the viral reverse transcriptase. The next one is protease inhibitors, and examples of protease inhibitors are indinavir. The indinavir is a protease inhibitor, and these protease inhibitors, they inhibit the viral protease which is involved in maturation of viral particles, and it is essential for the infectivity. The next one is fusion inhibitors, And examples of fusion inhibitors is infuviritide. So the infuviritide is a fusion inhibitor, and these fusion inhibitors inhibit the interactions of a viral glycoprotein with the CD4 cell membrane, and so prevent the virus entering host cells in a fusion inhibitors. And these fusion inhibitors, they are used when there is a resistance to other drugs. So next class is antifungal agents. So the fungal infections, they may be superficial in skin or nails, or maybe in a deeply seated, and they include tinea, that means athlete's foot, and candidiasis. Examples: thrush infections. Drugs are given either topically or orally. Examples are imidazole. Imidazoles examples like clotrimazole and miconazole. So all the azoles are the antifungal agents. Examples: imidazoles like clotrimazole and miconazole, and triazoles like itraconazole and fluconazole. So the imidazoles are and triazoles, they inhibit a cytochrome P450, which is dependent demethylase, which converts the lanosterol to ergosterol, a fungal membrane lipid. This results in the accumulation of lanosterol, which disrupts the membrane phospholipids. Disrupt means it cuts or it's break the membrane of phospholipids. Also, the imidazoles and triazoles, they are fungistatic, and also they be used after healing to prevent a relapse. Uh, and these imidazole and triazoles, they are widely used in superficial skin infection, and they are effective against both tinea and candidal infections. Oral administration or systematic absorption risk drug interactions via inhibition of cytochrome P450. So the antifungal agents class is polyenes. So the polyenes examples are amphotericin B and nystatin. And these polyenes bind to fungal ergosterol in the cell membrane, and they disrupt the cell by forming the pores. And these polyenes, they are effective in candidiasis but not in tinea. So the next one is allylamines. So these allylamines are terbinafine and griseofulvin. So the terbinafine inhibits the conversion of squalene to lanosterol by squalene epoxidase, with the accumulation of squalene causing cell death. And this terbinafine is a fungicidal, and shorter treatment courses are required for this terbinafine. So the next one is griseofulvin. So the griseofulvin, which binds to the fungal tubulin, and they disrupts the mitotic spindles involved in the cell division. And this griseofulvin, it is suitable for tinea infections but not for the candidiasis, and as it is ineffective against the yeast. So these are the antifungal agents. So next class is anti-malarial agents. So the anti-malarial agents, these are used as a preventive medicine to prevent the infection with mosquitoes-borne malarial protozoal parasites like Plasmodium, or to fight the infections against these protozoal parasite Plasmodium. That means Plasmodium falciparum, Plasmodium vivax. Also, the resistance is a problem, and the choice of agent, it is determined by the region visited in the body. So the antimalarial agents classes are 4-aminoquinones derivative. 4-aminoquinones, that also known as chloroquine. So this chloroquine, which binds to hemoglobin breakdown products, and these becomes concentrated in the erythrocytes, and this chloroquine it inhibits the parasitic heme polymerase which is used to metabolize the hemoglobin. So the hemoglobin accumulates, and this is toxic to the parasite, and this chloroquine it is only effective against the erythrocytic forms of the infections, and also this chloroquine it is used for the prophylaxis and the treatment of the malaria. So the next one is quinolone derivatives. So the quinolone like methanols like for example quinine and mefloquine. So these quinine and mefloquine they are similar action like chloroquine. The mefloquine it is associated with causing the depression, and also the mefloquine is mostly used for prophylaxis and quinine for the treatment. So the next one is folate antagonists. So the folate antagonists like progonil and pyrimethamine. So the folate antagonists which inhibit the parasitic dihydrofolate reductase, and they limit the availability of the folate, and also they have a similar action to trimethoprim, and also the progonil it is used for the prophylaxis, and pyrimethamine it is given with a sulfonamide like drugs in a combination of pyrimethamine and sulfonamide drugs. So the next one is 8 amino quinolones. So these 8 amino quinolones is also known as primaquine. So the primaquine it is a possibly inhibits the parasitic mitochondrial functions during the infections of the liver, and also the metabolites which may bind to the parasitic DNA, and this primaquine it is used for the treatment of malaria. So the next one is doxycycline. So the doxycycline these antibacterial agents they may be used for the prophylaxis if antimalarials are contraindicated or there is a resistance. So in these cases doxycycline is used. So the next one is artemether with lumefantrine. So this is a new combination is artemether with lumefantrine, and these artemether and lumefantrine which inhibits the parasitic conversion of toxic hemoglobin to hemozoin in erythrocytes during the active infections used, and it is used for the treatment of malaria. So the next one is antihelmintics. So these antihelmintics examples are mebendazole and piperazine. So these antihelmintics they are used to manage the parasitic threadworm and roundworm infections, and also the piperazine which activates the GABA associated. GABA means gamma amino butyric acid. So the GABA associated chloride channels in the worms, and which causing the muscle relaxation and their expulsion from the gut, and also the antihelmintics like mebendazole. So these mebendazole inhibits the microtubular functions in the worms. So these antihelmintics which are used in the worms which are generally in the stomach. So the next one is insecticides. So the insecticides compounds they are generally organophosphorus compounds. For example, malathion and carberry. So these insecticides these are used to manage the lice, and they inhibit the acetylcholinesterase, and so they break down of the acetylcholine in the louse is blocked, and which leading to the paralysis and also death. So the last one insecticide is permethrin. So this permethrin which activates the sodium channels in the louse which leading to the paralysis. So the important points include in this the antiviral therapy is limited regarding the selectivity. For example, acyclovir is activated in the infected cells and which leads to the inhibition of viral DNA polymerase, And also the anti-HIV therapy, it is used in a combination to attack the different stages of the viral cycle. And also the antifungal therapy, which largely focuses on the membrane biochemistry. Also the imidazoles and azoles, they are important cytochrome 450 inhibitors, and these may lead to the drug interactions. And also at last the antimalarial drugs, they are used for the prophylaxis or the treatments. So we in this chapter we see the various different types of antiviral drugs like acyclovir, ganciclovir, viral neuraminidase inhibitors like zanamivir and oseltamivir, and also anti-HIV drugs like nucleoside reverse transcriptase inhibitors like didenosine and judovodine, and also non-nucleoside reverse transcriptase inhibitors like epavirins, and protease inhibitors like indinavir, and also fusion inhibitors like inpiviritide, and also we see the antifungal agents like imidazoles like clotrimazole and miconazole, triazoles like itraconazole and fluconazole, and also pollines examples like amphotericin B and nystatin, and also allylamines like terbinafine and griseofulvin. And also at last we see the antimalarial agents like chloroquine, uh, quinine, mefloquine, progonil, pyrimethamine, and also primaquine, and also the doxycycline, and also the new combination which is artemether with lumefantrine. And also at last we see the antihelmintics. So the antihelmintics like mebendazole and piperazine. And also at last we see the insecticides, the organophosphorus compounds like malathion and carbaryl, and also the permethrin. So in this we end of this chapter antibacterial drugs with these antibacterial and non-bacterial infection drugs like antiviral, antifungal and antiparasitic drugs. Hope you understand these topics. So uh, thank you for watching this video, and please subscribe to our channel Pharma Extract, the division of excellence. So in this channel we uploaded the videos which are extremely important for your GPAT, NIPER, drug inspector exam. So thanks for watching this video, and please subscribe to our channel. Thank you.